You know, inside all of us, there's this organ working around the clock, doing literally hundreds of jobs without us ever noticing. But what happens when this silent hero starts to fail? So today, we're going to dive into the quiet, but absolutely critical story of chronic liver disease.
I mean, just imagine for a second, what if your city's main power plant and water filtration system just started to shut down? The lights would flicker out, the water would get toxic, it would be a total catastrophe, right? Well, what if I told you that exact same factory exists inside your body? That's your liver, and for millions of people, that factory is in serious trouble.
And this isn't some far-off hypothetical. For millions of people all over the world, this is their reality. It's the story of a slow, often completely silent decline of one of our most vital organs. So let's break down how this actually happens. Okay, so before we can really get into the disease, you've got to appreciate the organ itself. The liver truly is the body's unsung hero. I mean, this thing performs hundreds of jobs and never, ever asks for a day off.
So what exactly is chronic liver disease? Well, it's not some sudden event. The best way to think about it is like a slow burn, a relentless cycle of injury and the body trying to heal over and over that slowly over months or even years scars the liver until it just can't do its job anymore.
And its job is, well, it's a lot. Just think about it. It's the metabolic engine that processes all the food you eat. It's a factory building essential proteins that, for example, help your blood clot when you get a cut. It's the master filter, cleaning toxins out of your blood. It's even a storage unit for crucial vitamins. It's just this incredible multitasking machine that we absolutely cannot live without.
So what happens when this heroic organ gets hurt? Now, the liver has this amazing ability to heal itself, but when the injury is constant and doesn't let up, that very same healing process can actually start to backfire. And this is where things get tricky. See, at first, any injury kicks off a totally normal, healthy healing response. But when the damage is just relentless, that healing process goes haywire. The body starts laying down more and more scar tissue, this stuff called collagen, in a process we call fibrosis. Over time, that healthy, soft liver tissue gets replaced by hard, stiff scar tissue, completely messing up the liver's internal structure. And that final stage, cirrhosis, is pretty much irreversible.
So what's causing all this constant damage? Well, the list of culprits is surprisingly diverse. A lot of it can be lifestyle-related, from things like chronic alcohol use or obesity causing fat to build up. It can be from viral infections like hepatitis B and C. Sometimes the body's own immune system gets confused and attacks the liver. And in other cases, it's just in your genes, causing a toxic buildup of minerals like iron or copper.
Because the liver is so central to everything, its failure isn't a contained problem. Oh no, it sends this massive ripple effect through your entire body, touching pretty much every other system.
And here's the really crucial and kind of scary part. In the early stages, liver disease is notoriously quiet. The signs are super vague, feeling tired, a little nauseous, maybe losing some weight, things you could easily just brush off. It's only in the late stages, when a ton of damage is already done, that the really alarming signs pop up, like yellowing skin, bruising easily, and major swelling. This is exactly why it's called a silent disease.
So, okay, as the liver gets more and more scarred and stiff, what are the actual consequences? What does this failure really look like inside the body?
The number one problem is basically a traffic jam. All the blood that's trying to flow through the liver gets backed up because of all the scar tissue. This creates dangerously high pressure in the main vein leading to it. This condition is called portal hypertension, and believe me, it is the trigger for some of the most serious complications out there.
And that one problem, that high pressure, it just knocks over a whole line of dominoes. Fluid starts to leak into the abdomen, causing this swelling called ascites. Blood gets forced into tiny, fragile veins that can burst and cause life-threatening bleeding. Toxins like ammonia, which the liver can't clear anymore, build up in the blood and start to affect the brain, causing confusion. The spleen gets bigger, and the blood just loses its ability to clot right. It's a total systemic breakdown.
But look, this isn't all bad news. Not by a long shot. While the damage can be really severe, medicine has a pretty formidable toolkit for figuring out what's wrong and fighting back. So how do doctors even begin to piece this puzzle together? Well, they start with clues from simple blood tests, then use imaging like an ultrasound to get a good look at the liver. There's even this cool, non-invasive tool called a FibroScan that can measure how stiff the liver is. And to check for those dangerous bleeding risks, they might use a tiny camera called an endoscope. For the most detailed picture, a liver biopsy is still the gold standard to see exactly how much damage there is.
Once it's diagnosed, managing the disease is like a battle on multiple fronts. First and foremost, you have to treat the root cause. Stop drinking, get on antiviral meds, whatever it is. At the same time, you manage the complications with other medications. Nutritional support becomes absolutely vital. And because cirrhosis seriously ups the risk for liver cancer, regular screening is a must. It's all about stopping any more damage and dealing with what's already there.
Now, for people who are in the most advanced stages when the liver is really failing, there is a final life-saving option. A liver transplant is really the definitive treatment. It replaces the damaged organ and it dramatically improves a person's chances of survival. It's the ultimate reset button.
At the end of the day, though, the best way to fight this thing is to stop it from ever getting started. And honestly, understanding the risks is the absolute first step in protecting this incredible organ.
And look, the game plan here is actually pretty straightforward. Limiting alcohol is a huge one. Getting vaccinated for hepatitis B is such a simple, effective shield. And for so many of us, managing weight and diabetes is critical to prevent that fatty liver disease from setting in. These are all real, actionable steps we can take.
And this right here is the key takeaway from all of this. Your liver is incredibly resilient. It can take a lot, but it is not invincible. Catching this disease early, treating the root cause, and making those positive changes can completely alter the course of the disease. You can slow it way down and protect your quality of life.
So, all of this really just leads to one final thought, doesn't it? Given how silently this whole story can unfold inside you,